All right, welcome everybody, and thanks for participating in this spring's edition of the Community Building Institute. We are on session 6, and we're lucky to have Kate Chapin with us today. And Kate is going to talk about evaluation and looking at how do you measure kind of the success of the work that you set out to do. So without further ado, I'm going to hand it over to you, Kate.
Great, thank you. I'm happy to be here. And I want to welcome you all to this training and also thank you in advance for your participation. And I also want to thank you for your service as National Service and AmeriCorps Vista members, Senior Corps members, and staff from around campuses and other organizations that run AmeriCorps programs. I have worked in agencies over the years, and I can say that had vistas, and I can say that, got a chat. Okay, I've got, Josh, I have a chat here that says the link to the webinar and the email didn't work great. When you click on it, it says the webinar has expired. So.
Good deal, Mandy. I will. I'll resend it. Thanks for getting us that communication. That explains. Maybe people are trying to join and
okay,
having some weird stuff happen. So,
do you want me to pause and?
Yeah, if you'd pause for a couple minutes here, Kate.
Yeah, you bet. Sure, no problem. Yeah.
Okay, folks, if you are just joining, thanks for being patient with this. Sorry about the weirdness with the URL. I don't know exactly what happened. I went to go start the meeting so that I could meet Kate on the call, and it looked like the webinar that I'd set up had gone away, so I hastily created a new one, emailed it to you, and then learned that it was not working. So thanks for bearing with us. If you're just getting on, we're excited here to have Kate Chapin with us, and she'll be training today on evaluation for everyday use. So thanks for being patient, Kate, and I will turn it back over to you.
All right. Yeah, no problem. Flexible and adaptable.
Yes.
Way to be. It's good for program evaluation as well. So I want to welcome you all to today's talk on evaluation for everyday use. And so the plan for today is I want to provide you with some background information about why we evaluate. I want to give you some tools about what does evaluation look like? What are the challenges that you might encounter trying to evaluate your programs? I want to share a framework for evaluation, some specific strategies, and then also link you to additional resources. So the title, Evaluation for Everyday Use, is the idea is that you walk away with some strategies that you can easily put into place. So a little bit about me. I currently serve as the Director of Field Education for the School of Social Work at the University of Montana. And in this role, I'm responsible for evaluating our program and reporting on how well students are meeting our learning goals. And this is an important part of our accreditation process, but it's also an important part of education, making sure that that students are successful in learning the functions of being a social worker. Also, just recently, last summer, served as the principal investigator for an implementation evaluation for Healthy Montana Teen Parent Program up in Flathead City County Health Department. And then formally, I directed campus and community-based programs for survivors of interpersonal violence. And in this role, we received grant funding. And so there were specific outcomes we reported on, did client satisfaction surveys, interviewed stakeholders, pre and post tests for every prevention presentation. And there's a way of really monitoring our success, if we were changing attitudes or whatnot. So I've served also as an independent contractor, assisting with program development, program outreach, grant writing, and reporting, as well as community-based participatory research. So it's through these experiences that I really have gained an appreciation for evaluation, its function, its purpose, and also how we can use evaluation to improve our program effectiveness and also program efficiency. So I want to find out a little bit more about who's here with me this afternoon. So I'd like you, if you could use the chat room to just share the population you serve, and then also what's the location of your program. If you're in Missoula, North Dakota. So again, use the chat box to share the population you serve and then also your location. So got one of our participants serves middle school students in Missoula. It's a beautiful day in Missoula today. Young adults, 18 to 25, and they're in Bozeman. Girl Scouts of Great Falls. Girl Scouts has some great program evaluation, good research supporting its work. students in Missoula. Sidney, Montana, 6,000 in town, 8,000 in Richland County. All right, so far we're all in mid-Montana. All right, we'll move along here. There'll be more opportunities for you to participate, which I appreciate. So why is it that we evaluate? So in our roles in nonprofits, we're often asked to do more with less, and program evaluation takes additional time. So why do we do it? Well, we engage in program evaluation because it improves our programs. If a program is not effective, if a program is not effective, then we learn about how we can improve it. We learn about specific activities that should be continued or built upon, which activities should be modified and or eliminated. Program evaluation also improves staff performance, identifies our strengths, opportunities for improvement. It also demonstrates to funders and others that your program has an impact. I think this is incredibly important for us to remember, especially during resource scarce times, right? When there's not a lot of money out there, if we do receive money, we need to be able to prove that what we're doing is effective. Program evaluation helps us provide clarity and consensus around our purpose for everyone. So for the board members, for our staff, for our volunteers, stakeholders, funders, community at large, can make sure that we're all articulating the same message and that we're all on the same path to trying to produce the same outcomes. Program evaluation can also be used to raise additional money for your program by providing evidence of the effectiveness. So we know our program works because of XYZ, and therefore we want you to continue to contribute to funding to our program or contribute funding for the first time to our program so we can continue to do the good work. All right, so this presentation is going to focus on formative evaluation. So I have this slide here that just sort of describes the difference between formative evaluations and summative evaluations. So formative evaluations are ongoing evaluations for programs in progress, and a summative evaluation occurs after a program ends. So you are all part of programs that are running programs, so you're going to be engaged in formative evaluations. And here's this cartoon, got some feedback. It's a bad dog, and the dog is now requesting some formative assessments here so he can improve his performance. All right, so let's dive into a little bit more about what formative evaluation is and its purpose. So Formative evaluation, the process of ongoing evaluation for programs in progress, monitors our progress towards objectives. So I teach classes at the university, and I always try to use an opportunity to collect feedback throughout my classes. And the reason is it didn't take me long to teach classes and realize that if I only did the university-sponsored, evaluations at the end of the semester, then I had no opportunity to improve and implement what the students are telling me is going wrong or going right in the class. It was already too late. The course was done. I could improve future courses, but those improvements wouldn't impact my current students. So formative evaluation allows us to improve the programs and right the ship, so to speak. It helps us identify issues of interest, helps us redefine collection activities, and then clarify program strengths and limitations. As always, if you do have any questions as I'm going along here, don't hesitate to use the chat box, and I'll keep my eye on that. So the spirit that we're trying to maintain in program evaluation is that it's never too late to implement the evaluation feedback to improve the program that's ongoing. So it is true that you may encounter some challenges or concerns to program evaluation. And so I just want to take the next couple slides to address these concerns. So there is a concern that evaluation, that it diverts resources away from the program, and therefore by taking those resources away from the program, it therefore harms the participants. And so, because evaluation helps to determine what does and does not work in a program, my response to that is that it actually is beneficial to program participants. If we take time to understand if what we're doing is ineffective, then we can change the course. So not taking time to evaluate our outcomes presents more harm to programs potentially or participants. So another concern is that evaluation increases the burden for program staff. So often program staff are responsible for collecting evaluation information because they're the most familiar with and have the most contact with program participants. And though this definitely can increase the burden, it's also shown that staff can really benefit from this process. Because they're learning about what they're doing and how it is impacting their participants in a more nuanced way. It can help better identify or highlight participant needs, can validate the staff's successes. And so the burden, I think, can be decreased somewhat by incorporating evaluation activities into ongoing program activities. And so I'll talk a little bit about some strategies to do that as well. All right, so it's this idea that evaluation is too complicated. So, program managers can at times reject this idea of conducting an evaluation because they don't know how to do it or they don't know who to ask for help. And it's true that there can be the technical aspects of evaluation can be complex. The evaluation process itself, it simply systemizes what program managers are already doing and helps you identify kind of meeting objectives. So I have been hired as an external evaluator to a program, and there are certainly some benefits to that. But also the things that we're going to be talking about today are everyday ways of evaluating a program, and so can be implemented by the people and should be implemented by the people on the front lines. Concern number 4 is that evaluation may produce negative results and lead to information that will make us look bad or lose funding. So some of the people might find evaluation threatening, right? And it's true. An evaluation may reveal problems that you have in terms of the programs that you run, or, but it also is true that it will highlight successes. And both our successes and also where we're ineffective, so where we're effective and ineffective, both of those, that's valuable information. And so the discovery of problems doesn't necessarily mean that the program is problematic. It just means that changes need to be made so that you can be more effective and more efficient. So again, formative evaluation means we're improving as we go. And we really do have this ethical responsibility to ensure that our services are effective. And so if they're not effective, then we change the course. And I think all of you probably have that experience where you have an idea about a program you want to implement. Perhaps you're trying to implement a program that worked really well in a different county, a different state. Perhaps it's even an evidence-based program. And then you put it into action with your population, and along the way you realize, oh wow, this needs to be tweaked a little bit in order to support sort of the cultural resilience of the folks that we're working with. Or I don't know if Montana culture is really going to buy this strategy. And so let's make these changes along the way. So that's just a part of program development. So as opposed to it being sort of this threatening, we might get some bad information. We're going to learn, and that's just part of program development and program implementation. Any other concerns that you've heard of or that you have that I did not mention? If so, feel free to use that chat box. Okay. So what we're doing here today is we're really trying to cultivate a spirit of program improvement. Right? So in the cartoon, one guy, the guy that looks like he has no pants on, says, we got it wrong in the past. And then the woman says, but we learned how to do it right in the future. So that's really the spirit that we're trying to cultivate with program evaluation. If you don't know where you're going, how are you going to know when you get there? All right, so next I want to talk about a framework for evaluation. So this is the model that's used by the Center for Disease Control and Prevention, used to evaluate public health programs. And so in this model, you'll see there's a process of engaging stakeholders, of describing the program, and then focusing the evaluation design, gathering credible evidence, and then justifying the conclusions. So here's a different sort of a model or different graphic to view it. And I'll talk about each of these in separate slides. But again, you have engaging stakeholders at the top, then focusing in on what your design is going to look like. You're collecting data, and so we'll talk about different ways of collecting data, analyzing, interpreting, and then, of course, being able to put all that work into action, being able to use the data that your findings. All right, so let's talk about engaging stakeholders. So when we think about engaging stakeholders, we're thinking about those people, these stakeholders that are involved in our program operations, those that are served or affected by our programs, so our program participants, the primary users of the evaluation. So when we think about those who are involved in our program operations, we're thinking about the sponsors, collaborators, coalition partners, funding officials, administrators, those, and then we talk about those that are affected by our program. That includes the clients, as well as family members or neighborhood organizations, academic institutions, elected officials, advocacy groups. And then the primary users of the evaluation are the specific persons in a position who decide to do something regarding the program. So those that are implementing the program. So before you share who your stakeholders are, I want to give you a little bit of example here. So this is a feasibility study that I was a part of a couple years ago. And It was looking at green care farms in the United States, so looking at the feasibility of this. So just a little bit of a background on green care farms is green care farms are they're actual working farms where adults with disabilities engage, or older adults, engage in activities ranging from feeding or caring for animals to harvesting vegetables and preparing fresh meals. And so home and community-based options for adults with disabilities are pretty limited. And so this Green Care Farms is an alternative to these adult day centers. So instead of adults being able to go to maybe an adult day center where they could play bridge or watch TV or whatever it may be, this is an opportunity for adults to be engaged in sort of this community, earth-based, outdoors, community building effort. And so we wanted to know, this is really a popular approach in the Netherlands. And so we wanted to know how, and there's actually Green Care Farms up in the Flathead. And so we worked with the farmers up there and the participants to better understand if this was a model that is feasible to be replicated in other areas of the United States. And so our stakeholders for this study were the program participants, so these adults with disabilities or the older adults, their family members, so we would interview them about any changes, what was their experience with these farms. The farmers, so there's about 7 different farms that we interviewed. We interviewed the staff at the community-based, the adult day centers as well. So those were our stakeholders in that project. I did a study with this past summer, implementation evaluation of the Montana Teen Parent Program in the Flathead County City Health Department. And so the stakeholders in that project were the teen parents, right? We did focus groups with the teen parents. We did interviews with all of the county, the health department staff, with all of the participating programs, with the high school, with any program that refers their participants to this program, we interviewed them as well. So those are 2 living examples. I want to hear from you all. So use the chat box and share with me, who are your stakeholders? When you think about program evaluation and gathering data about your program and who your program impacts, who would you consider your stakeholders are? You can use the chat box. Okay, so my host cites stakeholders are the board, good, the students, academic staff, the volunteers, the donors, and community members. Good. Any other examples? Board of directors, program participants, staff. Good. Healthcare providers, good. Community leaders, serviced population. Okay. Great, those are good examples. All right, so we talked about that first phase, which is engaging stakeholders. Now I want to move into describing the program. So this is really how you all develop your elevator speech. So how you identify and then articulate the impact of what you're doing. So describing the program means that we're able to articulate the need that we're addressing, the expected effects of our program, the activities. So what is it that we do? What are our resources? And a good way to do this is by doing a logic model. And so we could probably spend a whole day talking about a logic model, and perhaps you've had a webinar on this. So I just want to give you an overview of a logic model as it applies to program evaluation. So a logic model is like a roadmap, and it helps you plan your route. So some of the results of creating and revisiting a logic model is that it helps you and all of your stakeholders have a common language about what it is you're doing, how you're doing, and if you're doing it, whatever you're doing is effective. It helps you differentiate between what you do and your results, so your inputs and your outcomes. It helps to increase understanding about the program. It really can help guide and focus your work. It leads to improved planning and management, helps you identify what your resources are and ways that you can measure, and then how you use your evaluation resources wisely. So I want to give you an example here, an everyday example of a logic model. So here, our inputs are that we're hungry. And so we get food, or I guess the problem here is that we're hungry. The input is that we get food. The activity is that we eat food. And the outcome is that we feel better. There you have it, everyday example. So here's another example of a more nuanced logic model, is a parent education program. So the situation here, similar to the hunger situation of the previous slide, is that during a county needs assessment, majority of parents reported they're having difficulty parenting and felt stressed out as a result. So similar to hunger, the problem here is need for additional parenting education. So the inputs here are the resources. They're what is considered essential for a program's activities to occur. So in the first slide, it was food. And in this parent engagement program, it's staff, you need money, and you need partners. So outputs are the specific activities that you'll create or produce. And they provide evidence of services. So you're going to assess parent ed programs, design and deliver evidence-based programs of 8 sessions. So that's what your model is. You'll facilitate support groups. And then outputs also include, so the population here, the population that you serve is also included under the outputs of the activities. So it's parents of 3-year-old to 10-year-olds will attend these trainings. So the outcomes here is that these are the specific things, the changes that we expect to result from a program's activity or intervention. So you see here, they're all pretty specific, right? Parents increase knowledge of child development. They have a better understanding of their own parenting style, new skills, higher level of confidence, etc. So we think about logic models as having essentially these 2 sides. So the process side, and then which has to do with the inputs, the resources that we have, the activities, and then the outcome side, which is the expected sequence of changes that the program is to accomplish. And some logic models will divide them into short-term outcomes, medium-term outcomes, and long-term outcomes. So again, the outcomes side reflects the difference that the program hopes to make. So let's talk a little bit more about the outcomes. So the outcomes, it's helpful to start with the end in mind. So for this parent education program, this program wanted to improve the parenting skills of parents of 3 to 10-year-olds. So if that's the end in mind, what do you want and then specifically, what do you want parents to get out of the program? And these are all really important for us to ask is the program making a difference? And then figuring out what works and what doesn't. So here's a blank one. I want to just take just a couple minutes for you all to share an example in each of these categories about how this might look in your agency. So inputs. What are some of the things that your agency invests in? So remember, some of those are staff, financial resources, partners, volunteers. So go ahead and include what are the things that you and that your agency invests in, and think about them as they're things that are essential in order for a program activity to occur. So use the chat to share your ideas here. Any ideas? Oh, got an idea. Volunteers, time, funding, good. All right, so let's move on to the output. Oh, do we have another one? Yeah, let's move to the output. So what are the specific activities that you do? And then also who is it that you're reaching with these activities? So again, remember in the previous slide, the activities were the parent education programs, support groups for parents of 3 to 10-year-olds. So give us a sense of what are the specific activities that you do? And then also who are you trying to reach with your programs? Yes, I can repeat the question. So I've just talked about these logic models. And so I've just briefly described kind of the input side and the output side. And so I wanted you to try to think about how you could apply this to your agency. And so we talked about the inputs, and those are the staff, the time, the resources. And now we're moving into this sort of second phase of this logic model. So what are the specific activities that you do at your agency or your program? So it could be, so using the previous example, this program does specific parent education classes, and they do support groups. And these activities are specifically designed for parents of 3 to 10-year-olds. So thinking about your own agency, if you were writing in the, we use that, we do an input, output, okay, good. Offering screening clinics, community needs assessment, offering English as a second language class, great. Perfect, those are good examples. And it sounds like, let's see, for example, there's a logic model for each semester and rows for each program, like yoga. That's cool. So based on your inputs and your outputs, what are your short-term, medium-term, and long-term outcomes? What do you hope are the results of your programs? Anyone, one or two people can share some examples, that would be great. So when you're teaching these screenings in Richland County and this community needs assessment and offering ESL, what is it that you hope are the outcomes of your program? We have an impact section, and they're always something like X number of students will report gaining X number of skills. Okay, so it sounds like based on whatever activity you're doing, you're going to identify what the specific skills are that you hope participants walk away with after your program. Yes, exactly. Okay, great. Long-term is reduce chronic disease rates in Richland County and increase English literacy. Awesome. Very cool. Okay. I think we got enough on the old logic model. Okay. So we talked about engaging stakeholders. We moved to, what did we do? Describing the program. We talking about logic model. Now we're moving on to focusing the design. So what are the specific ways that we want to collect data? And what are the key questions? And then as we're figuring this out, we're starting to think about what's feasible, what's ethical, what will be useful. No one wants to collect data just for the sake of collecting data. And you also don't want to create a plan that's going to be so cumbersome that you're not going to be able to actually do it. And then also thinking about what the timeline is. So after each program, after each quarter, whatever it is. So next slide is pretty basic. Taken any sort of research class, you know all about this, but essentially when we talk about collecting data, we talk about quantitative data and qualitative. So quantitative data is data that's numerical, that can be counted, quantified, mathematically analyzed. So this can be the number of people we served. It can be the length of service, achievement test scores, can be number of program beneficiaries. So because quantitative data is numeric, it can be easily ordered, organized, and summarized. And then qualitative data is the narrative information that describes the experience of the program recipient. So you might get the sense of, you know, there were 20 participants that attended this class, but just if we look at numbers alone, we're not going to get a sense of what that kind of nuanced experience is. And so this data, qualitative data, it's not easily reduced to numbers, and rather it's narrative information. And so when we think about qualitative data, the two kind of most common ways of collecting this data are through interviews and also through focus groups. And through these methods, we can get a sense of what are attitudes, characteristics, and then perspectives of these program stakeholders. Let's talk a little bit about that. So talk about here just some of the more common strategies here. So surveys, written, electronic, or phone. So these are, I'm sure that you all have probably already implement these surveys. But I think it's helpful when we're thinking about when we're going to implement a certain survey, is that we think about what are the formats in place that will be easy for us to implement. So I'll give you an example. I did some program evaluation for a domestic violence shelter, and in the shelter every week, all the shelter residents were coming together for a house meeting. And that was just sort of a process they already had in place. And so we talked about, okay, first it was, where's the best way we can collect satisfaction surveys from our participants? And then we realized, well, since these meetings are already happening, let's use these meetings as a way to collect this information. However, we wanted to make sure that we got some honest feedback, and so we wanted these to be confidential. There's only, you know, maybe 15 people that lived in the shelter at a time, and so we knew that if we were to open those surveys and read them right away, that we probably would not get some honest information if they knew that that's how we were reading the surveys. And so what we decided to do, since it was a 60-day shelter, is that we had folks that would give us feedback through these surveys that we did once a month at their shelter or at their house meetings, but we decided we wouldn't open the feedback until the next quarter. So even though we weren't necessarily able to implement that specific feedback right away, we were able to, we think, collect information that was more honest from these participants, because their confidentiality was respected. So that's just one example. So surveys, you can do pre, post, or quick and easy to disseminate and also to analyze. They can be completed completed anonymously from a large number of people at once. You know, we've got SurveyMonkey, Qualtrics, all these tools, electronic surveys. So it's very easy to create and disseminate. The cons is that a high response rate may be difficult to achieve, but it's also really important in order to ensure that there's quality data that you need for data analysis. So hard to really get a ton of analysis out of a small data set. And so for surveys, you really do need a larger data set. And surveys really do rely on those closed-ended questions where this respondent has to choose from the provided response options. And so there may be a lack of in-depth information. So focus groups and interviews are, like I said, great examples of qualitative data. There's a lot of, if you've ever done focus groups, I think there's a lot of magic that can come out of it. You can get a lot of information in a shorter period of time. There can also be that mutual benefit of you collecting data, but also the group participants are benefiting from being together and sharing ideas. And in my world, we call that mutual aid experience, where you're learning from and with each other, and you're also collecting data. And some of the downfalls of focus groups is that it does require a skilled facilitator. So you want to make sure that you have the appropriate training to be able to run these groups. And also transcription can take quite a bit of time. So this is true for focus groups and also for interviews, is that, I think they say that, 4 hours of interview or 4 hours of focus group is 1 hour of an interview or focus group equals 4 hours of transcription. So you can definitely outsource these to there's programs that can do a pretty good job of doing the transcription, but that does take resources. It costs money. We have graduate students, so that's pretty great, but it does take a lot of time. You can learn a lot through the process of transcription, but it is very time consuming. And then kind of another downside of both interview or qualitative data in general is that there's a certain skill sets that's necessary in order for that sort of thematic analysis to be able to understand the themes that come up in qualitative data analysis. And then here's a couple other examples: document reviews, participation observation. With all of this data, when we're thinking about program evaluation, we're trying to focus more on lives changed and conditions improved than numbers served. So qualitative data does allow us to really get at some of those changed attitude, improvement in quality of life. And so that's pretty important, because I could serve 600 people, but if my program, how would I know if that necessarily meant that my program was effective? So I want to make sure that I'm getting at really those changes in behavior, changes of quality of life, versus strictly just on the numbers. Here's a couple kind of creative ways of also collecting data. This is called photo voice. And it's a process where usually people with limited power due to poverty or language or ability, race, class, gender, ethnicity, or other circumstances, use photographs as a way of capturing specific aspects of their environment or their lived experience. And so it's typically a way to really, again, amplify the voices of those who are silenced for whatever reason, whether all the reasons I listed before. And it's this idea that a picture is worth 1,000 words. And so here's an example of a photo voice project of the eyes of people with spinal cord injury. Here's a photo voice from kids. And this is part of a community-based participatory research project where the participants, so those with the lived experience, become the researchers. And this can absolutely be a part of the program evaluation as well. So in Missoula, we worked on looking at the barriers to food security. And so we had researchers on our team who have lived experience with food insecurity to inform the process as well. So again, that's ways of amplifying the voice. So this is pretty cool. Proud of this one. Had nothing to do with this. So I'm just highlighting someone else's work here, but this is one of our students that graduated a couple years ago. Her name's Ellie Hoffman. She gave me permission to share this. So she was doing some work with the Missoula Food Bank Kids Count Survey. And so it's a program that the Missoula Food Bank runs to provide food for kids in this after-school program. And so she wanted to get a sense from the kids about whether they liked the snacks or what changes needed to be made. Did they provide enough snacks? And so she was tasked with that challenge. And so she showed up at these after-school groups, ready to talk with kids. And as soon as she got there, she realized there's no way that she was going to be able to capture any of the kids' attentions. I mean, it's like chaos, after-school chaos, kids, And so she decided she needed to alter her approach to gathering that data. And so she developed this survey for kids. And so you see, it's a very easy to read, asking them, how hungry do you feel after school? Not hungry, a little hungry, really hungry. So very simple and perfect for kids, these graphics. So here's the list of all the foods. So it's circle the food you like, cross out the ones that you don't like. So again, they're wanting to get feedback to know if the kids are liking their foods. And so, so then she had these little examples of the food that they're already providing. Pretty cool. I'm a big fan of figuring out when you can be creative in program evaluation. And I think both Photo Voice and Ellie's example here are really nice ways of getting creative. All right. So then we're getting towards the end here, but we can plenty of time to wrap up. So now we've talked about analyzing, interpreting. So you've figured out your research design, you've collected the data, and so now you need to analyze and interpret the data. So you want to create a timeline about how often you're going to look at this data. So it's so irritating if you were someone on the front lines, as I have been, and you're out there, you're doing the good work, and then you're also putting the effort into your evaluations and asking for the feedback and whatnot, and then you never see the results and you never see anything done with it. It's like they go in some file cabinet and no one has access to it. And so a big part of a successful evaluation plan is coming up with a timeline. How often are you going to look at it? How often are you going to do it? The surveys, for example. How often are you going to interpret the data? And then what's your plan for implementation? So like when I gave you the example of the domestic violence shelter, so we decided that every quarter we would interpret and analyze the data. So again, figuring out what you learned from that and what are the limitations as well. So this is, again, how are we going to improve our program? And then how are we going to improve our evaluation process? So this is never a static process. It's dynamic, always changing. And so what is it, when are you, so in your timeline, you're also figuring out, okay, how am I going to use this, improve the program based on what I learned, and then also get smarter about how I'm going to evaluate, and then disseminate. So this is where you can get fun too, or creative and have fun with it. So this is where you're communicating your findings, but you need to think about communicating your findings in a variety of ways for a variety of audiences. So it is, probably appropriate for you to create a formal report where you're, in detail describing your research design, describing the limitations, describing your findings, and describing your recommendations. You might include your logic model in there. You also want to think about how you might be able to present your information as like a case study or stories of impact. So again, we're thinking about humanizing the data. It's not just about we serve 35 people at this program, but this program impacted 35 people in this way. This is significant. These are real changes. This is why we need your money, right? So you're thinking about you want to be able to continue to do the work. So how would you disseminate your findings in news releases? You could even use snapshots or postcards that highlight some of the key findings. You could send them out to your stakeholders. You could send them out to your potential funders, to your grantors, whoever it may be. You try to hire some resources if you don't have them internally about how will we be able to make this look good. Videos are a great way to be able to disseminate findings. So you could record interviews with your organizational leader that discuss and highlight your evaluation, how the evaluation improved your organization, or how your programs impact your clientele based on your findings you have in your evaluation. And then you're thinking about disseminating broadly to multiple audiences. So board, staff, potential or current funders, partners, potential partners, community leaders, legislators. And you want to do it in a snappy way, snappy, snazzy, right? So here's an example of a employment development program where it's very visual. Yes, you will have to generate a report, I would assume, but there's probably going to be a smaller audience that's going to take the time to read your report. So how is it that you can get your findings out there with our culture that has a very short attention span and likes pretty colors and images, right? So here's a nice example. And then here's a one-pager that I did for that Healthy Teen Parent program. So part of my budget is that I hired a designer to help me with this because this is beyond my skill set here. But you'll see that in this one-pager, I created a full report that was also visually appealing. But the designer also created a one-pager that talked about the program that I was evaluating, what my overall findings were. And then again, we want to make sure that we're conveying that human element. And so we picked out different quotes from the participants that helped to really highlight the findings. And then we have this graphic here the designer created for us. So, and when we're thinking about these quotations and we're trying to really highlight the human experience, we're getting on the pull on your heartstrings kind of a quotes, right? So, this one quote, that's the main thing with the program I enjoyed. I'm not alone. Lots of times being a single mom, you feel really alone and it's a stress, but it doesn't make you feel that way, which I highly enjoy. All right. So again, here's the model, the CDC model, engaging stakeholders, focusing, collecting data, analyzing and interpreting our data, and then using and disseminating. So it's a lot of information. So if you're thinking, you're scratching your head, like, now what? I'd say, where do I start? So if you're, learn more about your agency's logic model. If they don't have a logic model, ask if you can help someone create one. It sounds like in some programs you do a logic model for every activity that you do in your organization, your agency, your program, which is great. And then get creative. What's feasible? What feasible and usable data can I collect in a creative way? And then here are some resources. I know we sent this out ahead of time, the Community Toolbox, and also the University of Wisconsin Cooperative Extension has some really great resources. And then there's the link to the CDC program evaluation as well. All right, so we just have a minute here. Anyone have any questions? All right, well, thank you all. Here's my contact information. If you do have questions later on, don't hesitate to reach out.
Thanks a lot, Kate. Appreciate you coming on and spending an hour with us. And to you all who logged in, thanks for participating in the Community Building Institute. And we will see you soon, I'm sure. So take care.
All right. Hey.